One of the first things that I saw when I went online and looked up Ulthera was an answer to a question, does it work and does it hurt? And the answer to both of those is yes, it does work, and there is some discomfort associated with it. Recently, Las Vegas 2011 cosmetic surgery meetings had a panel of experts who've been using Ulthera since its inception approximately 2 years ago, and it was very reaffirming to me, having done due diligence looking at this technology over the last 2 years and now incorporating it in our practice for the last few months, that all of the experts, the consensus was that it is very effective. They're seeing excellent results in their patients, with very satisfied patients. So it does work. We know that. I think that the protocols of how to treat patients best is still being worked out, and I think it's important to have someone with an artistic vision treating you, somebody who is expert in the technology, and it can be customized to individual patients. So both Dr. Sunder and I are very excited about incorporating the Ulthera technology into our practice because of its effectiveness. For me to take something from outside and bring it into our practice, it has to be proven to be both safe and effective. There's many technologies that patients ask us about, like Thermage. They say, well, that really didn't work in the past. Well, we never brought it into our practice. I think it's very important to distinguish between technologies that are very effective and repeatedly so, and versus technologies that may work occasionally with one patient or this patient, but have a high dissatisfaction rate among the majority of patients. Does it hurt is the next common question that we're asked. There is some discomfort, again, involved with Ulthera. When I sampled it, and it was almost enough of a discomfort to me to know that something was being done. There's a wide range. Some patients will lie there and have the entire treatment and go, that wasn't too bad. Other patients are all over the place. So there's a wide range in response to the treatment. There are ways of making it more comfortable that we use, and whether that involves taking a pill or two prior to the procedure, or having some local anesthetic injected in certain areas where the nerves are blocked, that can be done, all the way up to giving patients a pretty strong narcotic if necessary. Obviously, in the cases where we give pills or narcotics, the patient has to have someone else drive them to the office. We don't want them driving home after that. But for the most part, we find that patients are motivated to look better, to have a little bit of lifting and tightening of their skin, and they get through the hour to 1.5 hour of treatment fairly well. Afterwards, there's a little soreness, almost like you feel like you've done some muscular work. If you've been to the gym and did a lot of sit-ups, there's some soreness in the muscles of the abdomen. There's some soreness in the muscles of the face for a week or two. I haven't seen any bruising. It's been reported in some patients after the treatment.